Welcome back. Celebrities spend a lot of time and money to get their skin looking flawless for that red carpet. And you too can get that Hollywood glow, but for less time and money. Dr. Sayed Amiri is a dermatologist at the Reston Dermatology and Cosmetic Center. And the doctor joins us this morning to go over some of those promising procedures. And most of these we're going to talk about, take about an hour or so in the office for treatment. And you know, overall, not too expensive if you have the money to spend on getting your skin looking great. Good morning to you.
Good morning to you as well. Yes, that is correct, actually. And part of it is, I guess, in terms of what I specialize in, which is minimally invasive cosmetic procedures that really take little or no downtime as well.
Awesome. All right. Well, we have 4 to get to. And the first one is, we have before and after pictures. The first one is of, we're calling it wrinkled skin. That's not very eloquent. But basically, this is a look at a woman on the left and a woman on the right. It's a dramatic difference. Tell us about this procedure.
Well, this lady had a laser CO2 resurfacing, which is carbon dioxide laser resurfacing. And that's a dramatic difference. This is in about 6 weeks or so. And if you look at all the wrinkles are smoothed out for the most part. Now, if she had a second treatment, she would have even more improvement. But her skin is tighter, it's smoother. A lot of the blemishes are gone. And this now requires a lot more downtime.
Right.
And this is about 2 weeks or so. But this took about an hour to do the procedure.
Non-invasive and 3 to 5 day recovering time, and it costs around $350. Now, is that per treatment? You said if she'd come in again. So when she came in to get this done in under an hour, that's $350. And then if she came in again?
No, this actually is much more than that. And so the $350 price that you have, it's primarily more for redness. Now, she has redness as well. But her main concern was really the wrinkles and extreme sun damage, which is the brown spots. And so this was more than that, and also it definitely took under an hour to do.
She looks gorgeous, though. Okay, let's look at, we've heard a lot about Botox. Here's an example of it before and the after, and we've talked about this. We know it reduces the wrinkle, it relaxes the nerves inside the muscle, and then a needle is used to administer Botox, right? Let's talk about what we're seeing.
Yeah. So this Botox is used primarily for the forehead areas. As you see there, the frown lines, which they're barely visible, and as well as the crow's feet area. Those are the 3 most common areas. And the needle that I use is the 32 gauge, which is very small. And so the pain is much less as well with smaller needle. And that takes care of those. And it takes about 3 to 5 days or so for the Botox to take effect.
Boy, but those lines are completely gone. Okay. The next look is an example of a procedure that uses fillers. Tell us about this next procedure we're going to see before and after here.
Well, fillers, there are many that are on the market now. So you have Restylane, Juvederm. Now, this is a little bit different. This is actually the liposuction of the neck area. So there was liposuction of the neck and jowls. And she also had some chemical peels as well as products. Now, one of the things that is really important is to use really good products. And a lot of people, when they think about cosmetic procedures, they really straight go to procedures. But one of the things that I always emphasize to them, that your skin has to look good.
That's a dramatic difference.
Yeah, it really is. Now, you know, the difference between, when people come to me, they ask me whether they need something like liposuction or facelift. Like in her case, all she had was really just neck liposuction, and that really tightens up the skin.
That's amazing. I think we have one more example of before and after the show. And I thought that was, I think the chemical peel. Is this the chemical peel?
This is the chemical peel, yeah.
Wow. Talk about that.
So a chemical peel. So she has acne, and if you look at this, would be considered moderate acne. And I usually put them both in topical products as well as antibiotics. And then the next thing I do is really chemical peels. And this is in about 4 to 6 weeks, they have dramatic improvement. And that's the difference between just putting somebody on skincare products versus also doing some procedure for them as well. So in this case, she had a procedure done as well, and she had improvement much more than it would be longer than 4 to 6 weeks. With medical treatment, it takes 4 to 6 weeks minimum for them to begin to show improvement. Whereas if we do chemical peels, it's much sooner than that.
That's how they get those flawless complexions. All right. All this is going to be on our website, myfoxdc.com. Dr. Sayed Amiri, is the dermatologist with Reston Dermatology and Cosmetic Center. Appreciate it. Fascinating look at what the stars do. And us, too. Those were regular folks. Back to you guys.
Not just the stars anymore.
That's right. Well, Sarah Simmons and